I'm Dr. Kirk Miller. I'm the Oregon State University faculty person who works full-time at the Oregon Humane Society. And what I'd like to do this evening is talk a little bit about a unique partnership between Oregon State University and the Oregon Humane Society and some opportunities that I see for the future. So a show of hands, how many people in the room have pets? Okay, great. So keep your hands up. How many people in the room take their pets to the vet? Okay, great. So about 7 years ago, we had a fourth-year veterinary student. I'll call her Ellen. She came to the Oregon Humane Society. It was about this time of year, and she said, I graduate from veterinary school in 3 weeks, and I do not know how to spay a cat. Yeah, so after 4 years of college, and 4 years of veterinary school, a lot of graduates do not feel prepared for practice. And they're probably right. And they're out there. And they're nervous about this. So how do I know this? I'm one of about 1.5% of veterinarians who's gone above and beyond. I'm board certified in canine and feline practice. I've been in practice for about 20 years. I graduated from one of the top veterinary schools in the country, but most importantly, I've been teaching veterinary students for the last 7.5 years. And I've taught more than 550 veterinary students. So I feel like I have a pretty good handle on what veterinary students are learning and what they need to learn. So that's who I am. What I do is I teach students the practical, hands-on skills that they need to be practice ready when they go out into practice the first day after graduation. What I do is that I get students ready for practice. Where I do it is at the Oregon Humane Society. And the reason for that is that that's where the pets are. A long time ago, when most veterinary schools were started, they were part of the old land-grant university system. So they were started as agricultural colleges, and they were started in places, and the vet schools are still in places like Ithaca, New York, Columbia, Missouri, Manhattan, Kansas, Pullman, Washington, and yes, Corvallis, Oregon. Places that don't have a lot of people, and so they don't have a lot of pets. So it's hard for students to get the hands-on experience that they need, but I digress. Let's get back to Ellen. When she came to the Oregon Humane Society, she had performed a total of 2 surgeries in 4 years of veterinary medical school. When she left the Oregon Humane Society, she had performed 45 surgeries. So she's doing a lot better. She's feeling a lot better. And they don't just perform surgery at OHS. They provide a lot of medical care for patients. They do physical exams. They perform dental care for the patients. They do a lot of things. So it's a win-win program. The pets get the care that they need, and the students get the hands-on experience that they so need. So today, Ellen is practicing in Eugene, Oregon. It's not a great town to be a beaver, but she's doing well. And she had a good experience, and she learned a lot at OHS. And this is just some of the quotes that the students have given to us over the years. The fact is the OHS rotation is the top-ranked rotation out of all the 4 years of veterinary school because the students love it. They get to come in, they get to get their hands on patients, do good work, and help the animals. But the students really do need more. They need practice communicating with clients because the old adage is that dogs don't show up at the vet clinic with a mouthful of money, and cats definitely won't. People bring the pets to the vet, often reluctantly, but they do. And so students need practice talking to people about what their pets need, conveying the needs of the pet to the owners. And this definitely takes a lot of practice. The original partnership between Oregon State University and OHS has done a lot. It's been a tremendous experience. As I said, the students just cannot get enough. And we even turn away students from other parts of the country. We take students on a space available basis, but we turn them away quite often. There's great demand for what we do at OHS. Another thing that's come up in recent years is an increase in the number of medical surrenders. And these are people who cannot afford veterinary care for their pet's special needs, and so they have to surrender the pet to the Oregon Humane Society so that the pet can get care. And this isn't a great situation for the owner. This isn't a great situation for the pet. For example, Hallie. Hallie is a 6-year-old diabetic kitty who's been at the Oregon Humane Society for over a year waiting for her new home. She has diabetes, so she's on insulin injections. And so that's what we consider to be a barrier to adoption. A lot of people just aren't willing to take that on. But Hallie's been sitting there. She's not happy about it. I talked to her. She told me she's not happy about it. It's not good for her. It's not good for her former owner. It's what I call a lose-lose situation. And it's not good for the Oregon Humane Society either, because the cost of care for Hallie in our setting is probably more than if we found a way to help the previous owner keep Hallie in her home. So I see opportunity here. I see an opportunity to help people who need help caring for their pets. I see an opportunity to help students who desperately need more experience, more hands-on experience. We can create a community hospital where people who need care for their pets can bring their pets in, get the care that they need, and the students can get additional experience that they need. Because these students are going to be taking care of our pets in the near future. Thank you.